One of the things we've done is that we have disproportionately in science focused on the negative effects, the pathological effects related to drugs. These things are so dangerous, these things are so addictive that we must wage a war to get them out of our society. And those assumptions are just false. The biggest myth related to drugs is that most of the people who use them are addicted or become addicted relatively easily. And that's just simply not true. Only about 10 to 20% of the people who use these drugs become addicted. We bring people into the laboratory, people who are addicts, and we have shown that if you give people attractive alternatives to drug-taking behavior, so offer them something like money versus drug, you can get them to shift away from taking drugs and to take money if the amount of money is high enough. It shows that their behavior isn't driven solely by the drug, as the public has been misled to believe. Rather than providing drug-related information, what we do is provide drug-related hysteria, and we frighten the population rather than educate the population. And the folks who paid the price the most are poor people, poor racial minorities. But whenever you have losers, you also have winners. The prison systems, they are winners. Law enforcement, they are winners. Even at some level, scientists, because it's kind of easy to say that, hey, we're solving this awful problem, we need increased budgets to deal with this. If we were going to really educate people about heroin, let's say, 70% or more die because they combine that drug with a sedative like alcohol or benzodiazepine. The public health message that should be blasted is don't combine heroin with another sedative, if we were really concerned. That's not to say that people should go out and use illicit drugs. It's to say that we need to be honest, completely honest about what drugs do and what drugs don't do. When it comes to drugs, the evidence is overwhelming that we are going about this the wrong way.